Hello, my name is Michael. I am a social worker and discharge planner at the Get Well Soon Mental Health and Behavioral Health Facility. And this is my first real face to face session with um, Ms. Jennifer. And we are going to, um, I'm going to ask her some questions and kind of just get some background information about herself and find out the precipitating factors that have led to her admission here at the inpatient facility and try to identify some needs and some immediate goals and go from there.
I'm Jennifer. I was recently admitted to the Get Well Soon facility because a family member of mine took me to the emergency room because I had just spent the last few days in bed and I was making some suicidal comments, and I do have access to some narcotics that I would be able to overdose on if I did choose to go down that route. And after being seen in the emergency room by the social worker on staff, they referred me to be admitted to this inpatient mental health unit, and I am just presenting for my first assessment.
Hello, my name is Michael. I am a social worker and discharge planner at the Get Well Soon Mental Health and Behavioral Health Facility. And this is my first real face to face session with Ms. Jennifer. And we are going to I'm going to ask her some questions and kind of just get some background information about herself and find out the precipitating factors that have led to her admission here at the inpatient facility and try to identify some needs and some immediate goals and go from there.
I'm Jennifer. I was recently admitted to the Get Well Soon facility because a family member of mine took me to the emergency room because I had just spent the last few days in bed and I was making some suicidal comments, and I do have access to some narcotics that I would be able to overdose on if I did choose to go down that route. And after being seen in the emergency room by the social worker on staff, they referred me to be admitted to this inpatient mental health unit, and I am just presenting for my first assessment.
Okay. Good afternoon, Jenny.
Hi.
My name is Michael.
Nice to meet you.
Okay. I understand this is your second day here at the hospital. How's everything going? How are you feeling right now?
I don't know. I don't really care. We haven't really done anything.
No. Are you going to the groups?
I went to one. They
Mhm.
made me go to it.
Made you go to it? Okay. Well, I've looked over your consult, but I kind of want to get from your perspective and in your words. Can you just tell me some of the precipitating causes and things that kind of led you to be admitted here in the hospital?
My husband took me to the emergency room the other day because he said I didn't get out of bed for 2 or 3 days, but I don't think that I was actually in bed for 3 days. I think he's exaggerating. He was just worried because I'm just in a funk. I don't feel like anything's worth it anymore. And I think he was just worried about me. And the social worker at the emergency room, she spent about 2 minutes with me. She just would have, let me rest for a little bit. I think I would have been fine. I don't think that it's necessary for me to be here.
And you said is it a boyfriend?
He's my husband.
Your husband, okay. How long have you guys been married? How many years?
2.
2 years now, okay. Do you mind if I ask what his name is?
His name is Roger.
Okay. Is Roger, your husband, is he currently employed?
Yes, he works, I don't even remember the name of the place he works at. He works for one of the manufacturing companies in town. I don't remember the name.
And I'm writing this information down just for myself. It's nothing bad. And what about yourself? Are you currently working? Or are you in school?
I was laid off a couple of months ago. I was a teacher.
Oh, cool. What grades?
I taught kindergarten. The school made some changes, and apparently they didn't need me anymore.
Okay. Do you have any children of your own?
No.
With Roger? How long have you been laid off?
It's been a couple of months.
It's been a couple of months. 2 to 3 months, you'd say?
Probably about 3 months.
Okay. And you said you came in, or your family recommended and brought you into the emergency room because you were in bed for a few days, right?
Roger was worried that I was going to hurt myself when he went to work, so he didn't know what else to do with me.
Okay. Well, it seems like Roger is very supportive. Would you say your husband is supportive of you being here and getting treatment and help?
I guess so.
Okay. Are there any other members of your family that you would say are supportive for you as well?
My mom checks on me every once in a while, but I never want to worry her with anything, so I haven't even told her I've been laid off.
Okay. Does your mother live in the same area as you?
No,
Okay.
she lives in Wisconsin.
Do you have any other relatives in town?
Not in town.
So Roger is your main support member. Okay. All right. Well, I'd like to go back to you mentioned being laid off for 3 months. Were you before you lost your job? Would you say you were, or do you think were you in bed and not wanting to get out and such while you were still working, or do you think maybe?
I loved my job. I love to work with kids. I've always wanted kids of my own, but Roger and I found out a couple of years ago when we started dating that I'm not able to get pregnant.
Okay. So having, a child and raising kids and starting a family is something both of you are interested in, you would say?
Well, not anymore. I'm pretty useless as a wife.
You do know there's other options with having children. Advanced technology, there's adoption. We can go over some of those things, on another day, another session. Would you be interested in finding out more about those?
I don't care.
Okay. You say I don't care. Is that a maybe, yes, no?
If you have time for it.
Oh, definitely. You said this is your second day here at the hospital. Our average stay is usually 5 to 7, so you'll meet with me at least 4 more times during that stay. So we have plenty of time to go over that and anything else that you may ask. Okay. All right. So you said that you've been let go from your job at the elementary school. It's kindergarten, right? You said it was 3 months ago. Okay. And Roger is currently employed with a manufacturing company, correct? Okay. Can you tell me a little bit about your financial situation? How is that going? Are there any stressors involved with that?
We are having some trouble paying some of our bills. Our mortgage payment is what Roger's really concerned about. He makes a lot of money, but I did too. So losing that part of our finances has taken a real strain on us. It's like we don't have enough money to, if anything emergency were to come up. His car broke down last week, and I know there was nothing that I could do to help him out with that. He had to miss a couple of days of work because of it. He works, his company's a little bit of a drive. So I'm feeling pretty useless.
Are you currently seeking any unemployment benefits from your job, or are you guys doing anything public with public assistance, anything like that?
Roger keeps trying to get me to start looking into it, but I've just been so disgusted that I can't even bring myself to look into that kind of stuff. I just don't have the energy for all the paperwork.
Okay, Ms. Jenny, can you tell me a little bit about, let's see, if you had any past inpatient admissions? Can you tell me a little bit about like any medical needs that you've had addressed in the past?
I used to see a therapist for anxiety. I used to go a couple of times a month. I've had a problem with that in the past. I just get really anxious in social situations. And, I recently started taking Xanax and as needed, and it usually helps.
Are you still taking Xanax for
Mhm.
your anxiety? Okay. Any members in your family, have they had any mental health diagnoses? Your mother, Ms. Roger, anything else?
My father was diagnosed with schizophrenia in his 20s.
You mentioned your mother lives in Wisconsin, but you haven't mentioned anything about your father. Currently, is he involved in your life? Is he in the picture?
He actually passed away about 5 years ago from cancer.
I'm sorry to hear that. Can you tell me a little bit about your relationship with your father?
We were really close. I took care of him while he was sick.
Okay. Well, Miss Jenny, I think I got a good overview during this assessment. I can tell that you're kind of getting a little anxious yourself, so you may benefit from, I know it is room time, so you may be able to get a little nap in or something to help relax and calm yourself down. I do encourage you to continue going to the group sessions. I know they are voluntary, but it does benefit you. I truly believe that what they discuss and teach you guys in there is beneficial. Even if you just learn one type of coping mechanism that they provide for you, that would help you out. So just try to continue going to those, and I will would like to see you again tomorrow afternoon, and I will pass this appointment along, information along to your attending physician and the nurses as well. And we will, for that next session, I'd like to touch upon the on possibly obtaining, unemployment benefits and maybe some public assistance, and possibly helping you, look for other jobs since you do have a teaching degree. Maybe we can find some substitute positions just to kind of, get you slowly back in the game, into that field, and get your foot in the door, to possibly get a full-time position at another school that may be better for you. Um, and then I would also like to talk a little bit more about your anxiety with social situations. Maybe we can come up with some tips and things to help you overcome that. Kind of identify some certain situations where that does come about. And also, you mentioned that you feel useless because you don't feel adequate as a mother or as a wife due to not being able to have children. Is that right? There are other options out there, and since you and your husband are both interested in having a family, I think we can discuss that at our next session. So for tomorrow at, let's say, 2:30, are you comfortable with that time in the afternoon? Okay. We'll touch upon more about unemployment benefits, finances, maybe work on a budget while you're only having one income in the family. Work on some anxiety tips and discuss alternatives for having a child. So, are you okay with going over those tomorrow? Okay. All right, Jenny. Well, it was nice meeting you,
Nice
and I
meeting
look forward to seeing you tomorrow. Okay. So get some rest and